what is the difference between IUI and IVF? Should one go for IUI first and then IVF? I have PCOS and my gynac suggested IUI. What makes it too late to even try IUI and go straight for IVF?
Okay, now when you look at, I'll just tell you about the treatments of infertility.
Sure.
See, the treatment of infertility, if you look at it, that 80% of the people who come to a general infertility clinic conceive just by counseling. Okay, because a lot of people have this misconception. Just like I was telling you, they don't know the real time of ovulation, they don't know when they have to try, they don't know a lot of times. I would say 80% of the time it is purely by counseling. In that 20% of the people will require some form of treatment. Like say ovulation, like produce more number of eggs, that's called ovulation induction. You produce more number of eggs, you like say one egg is coming, she is not getting pregnant, so give them more eggs, so at least one of them will become fertilized by the sperm that enters.
Yes.
Now in certain situations, like somebody having sexual problem or somebody having a little deficiency in sperm, not very poor sperm, IUI will not help. There's a procedure called as IUI. IUI is nothing but pushing the sperm, washing and preparing the sperm and concentrating the good part of the sperm. See, you're not making the sperm better. You're only taking the best part of that particular patient's sperm, concentrating it, putting it inside the uterus at the time when the ovulation is happening.
Okay.
So we give her medicines, produce eggs, we give injections for the eggs to rupture. At that, we confirm the rupture, and at that point of time, you take the sperm, wash it and put it inside the uterus. It's like a shortcut.
Okay.
Normally what happens is, you ejaculate into the vagina, the sperm has to swim through the cervix into the uterus, it goes into the tube, outside the egg is ovulating, it goes into the tube, so both of them will end up meeting inside the tube, it becomes an embryo,
yes,
slowly comes and falls into the uterus. So actually it's a very technically, wondering thing that happens actually inside. So it's so easy not to get pregnant. Unlike, so when I said 20% chance of getting pregnancy, because I think a lot of people have this perception of movies and all, you have sex once and you get,
that's it
and you get pregnant.
Have two flowers also hit each other and you're pregnant. Yeah.
So for them, they don't realize that getting pregnant is not that easy. Some people find it so easy. Every time they're so fertile that they try and they get pregnant faster. But in majority of them, they don't get pregnant that easily. So IUI means you are taking it one step ahead. That is, you are producing more number of eggs and putting the sperm. So it's like kind of a shortcut of things what is happening. But for an IUI to be working, you should have everything else normally. Especially the female inside has to be normal. The tubes have to be normal, because the sperm, the tubes have to, anyway egg has to come through the tubes into the uterus, and we are only kind of overcoming that sperm being pushed into the uterus. That is the only thing that we are doing it. So IUI is a very simple procedure. It's actually like sexual intercourse only, but we are just timing things and making things happening, and it is washing the sperm.
Science into it.
Bringing science into it. It's basically only that. But if you look at IVF as a more technical thing, see what basically happens is everything that is, so like I said, there are so many places where things can go wrong. Like if the uterus it's not going into the uterus correctly, it is going somewhere else. If the egg is coming here and the sperm is going there, all those things can be reasons why patients are infertile. So IVF means what happens is you have an egg, you create an egg for the female, you take it out of the body, you have sperm and fuse it outside. So test tube treatment or IVF, in vitro fertilization is, in vivo fertilization is fertilization inside the body, in vitro fertilization is fertilization outside the body. So you're fertilizing it outside the body. That is, IVF basic process means you have the sperm and egg, we put it into a small dish and we wait for that to become an embryo. That is a basic IVF. And the next procedure that is called as an ICSI, that is intracytoplasmic sperm injection. That is, you take a sperm, now especially in patients who have very less sperm or thick egg, some oocyte problem or sperm problems when the sperms are very less, what we do is we take that sperm, inject that sperm into the egg and make it to an embryo. So the possibility of becoming pregnant, that egg becoming an embryo is much higher with an ICSI. But then everybody don't need an ICSI. A lot of times IVF is good enough, but if there are some issues, then we'll have to do an ICSI process for them. So, but then here we don't really say that we are going to do an IVF or ICSI for you. Whatever may the patient require, we just do it for them. If it's an ICSI, we do. See, majority of the time we end up doing an ICSI because we don't want them to fail. See, if it does not become an embryo, I cannot see. For example, in the UK, I think it's mandatory that you don't do an ICSI first. You do an IVF.
Yes.
it fails, then you do an ICSI,
Yeah.
come back. See, again next time you have to go through this whole process again, and probably they are able to dictate it because it is funded by the NHS. So they pay for it, so they decide what is to be done.
Absolutely, yes.
Whereas here, a patient comes to us, they want to get pregnant in the first attempt. They don't want to go through several failures and then go through that.
The maximum success
They want to
rate
get the
yeah.
maximum. So at that point of time, most of us actually end up doing ICSI for majority of the patients. But IVF is the basic treatment. Then the next step is ICSI.
So with IUI, is it the same medication given then with an IVF patient?
No,
is it the
IUI
same?
is much simpler. Like I said,
Okay.
we don't want too many eggs. We just want, in patients like say PCOD or somebody who don't produce eggs, we just need one egg is also fine. So we just give medicine, so you produce 1 or 2 eggs. But who are already having 1 egg, we'll give them medicines to make some 2 eggs or 3 eggs, so that we don't want too many eggs. Because again, one of the complications of these things are having multiple pregnancies. Now, multiple pregnancies, okay, it's not a very big thing in India, but if you go abroad, in the UK or where they're so concerned, they talk about cancelling an IUI cycle if the patient makes more than 3 eggs. They say that if multiple pregnancy comes, the burden is actually on the government. Yeah. The burden of the child, because if they have multiple pregnancy, the chance of preterm labor is higher. Yeah. They deliver that baby faster. If they deliver that baby faster, then the baby goes in an ICU, and that charge or what the government spends on the patient will not be able to afford the patient in the NICU. So NICU is not able to go through that NICU setup, and then baby complications. If the patient goes in an NICU, baby can have a lot of additional problems. So we always prevent or try to avoid multiple pregnancy. But like say twins and all, here in India we manage. It's not a very big deal because here people want that maximum benefit out of the money. They get it one IVF, they have 2 kids, they're done. So double bonanza. It is like one free with other. That kind of.
The whole family is done.
Family is done, so they're happy. Then they don't want to. They're done with it. Otherwise, like again, they have to go through this treatment. Again, they have to go through this whole process. I know. But yes, it is not something that we intentionally want them to have twins or intentionally that we want them to have multiple pregnancy. But yes, when multiple pregnancy, we take them forward like that and get them delivered. So with IUI, we are looking at 1 or 2 eggs. So we only give them very little medications. We will not give medications as what we had given in IVF. Whereas in IVF, we'll end up giving majorly injections only.
Yes.
Unfortunately, we don't have any tablets or oral medications that can replace these injectables, because we are looking at say making 10-15 eggs, whereas in IUI we are looking at making it 1 egg, 2 egg, 3 eggs, like that. And when I'm giving this, see, when I say I want 10 to 15 eggs in an IVF, it's not that I'm going to take 10-15 eggs and 10-15 babies are going to get formed. If the patient makes around 10-15 eggs, there will be, when I take the egg out, there will be approximately around 10-12 good quality eggs might come out of that follicles. So we're talking about number of follicles. When you stimulate, we don't see the egg, you only see the follicles in the ovary. So we take that, we aspirate the follicles, we might get around 10 to 12 eggs. We do an ICSI or an IVF, we try to fertilize them. Not necessarily all 10-12 of them will fertilize. There's a say 70 to 80% fertilization rate. So that means around say 8 to 10 or 7 to 8 is the number of embryos that get formed. And then again we grow them for 2-3 days. So again from there only some 5 to 6 embryos. Ultimately when we aim for 15 eggs, we are actually going to have say 4 or 5 eggs or 6 eggs, embryos that are of top quality, which can be used. And when we have these many number of embryos, we transfer like 1 or 2 embryos depending on the situation. If it's a bad case, we end up transferring 3. So that is how we aim for. That is why we need higher dose of medications, and the protocol is completely different in IVF compared to an IUI. And the whole basis is that for IVF, we don't want the egg to rupture inside. We are taking it out of the body before it ruptures inside. Whereas IUI, it is rupturing inside. It's a very simple thing. We're just putting the sperm, that's all. For IUI, we're not doing anything else. But for IVF, we're actually making sure that we are making all the eggs, ripening it. Before it ruptures, we take it out of the body. So that's why it's a very controlled process, and that's why it needs so much of intense monitoring, medications and things like that.
The cost of an IUI, is that way less than?
It's way less.
Okay.
I would say medications and scans and altogether probably it will charge you somewhere between 15 to 20,000 rupees.
Oh, is that it?
And IVF is like what it is 2 lakhs. Now to the question as to you would ask whether somebody with PCOD should go for IUI or IVF. See, I think it depends again on their age, how is the semen factor, how the sperm factor. If it is a simpler cases, definitely we should always attempt and simpler techniques. See, a lot of people come thinking that IVF is a 100% result treatment. So they come thinking that you do an IVF, finish it off, have a baby and go. But I always tell them, please don't rush into it. Always we need to go in a step-by-step manner. If there are no specific reasons that you don't warrant direct IVF, always go in a step-by-step manner. Try medications, try IUI. If that does not work, then check for tubal test, laparoscopy, again IUI, and things slowly we go into an IVF. Because if you're getting pregnant faster through a smaller technique, sometimes like I said, no, just by counseling or just by talking to them they get pregnant, because
the right way of going about it.
A lot of people whom we think are educated probably have no clue of what actually happens.
Yes.
So it's very important that we talk to them. You ask them, yeah, we are having regular sex. When you ask specifically, they'll say, yeah, on those 2-3 days we are having regular sex, and after that no sex.
Yeah.
And sex has become so difficult now at this point of time. Lifestyle is difficult.
Yes.
It is unlike that what was earlier. Now this is a big stress factor. So stress factor, infertility, sexual life, it's all become a cycle. One affects the other. Infertility affects the sexual life affects infertility, stress. All those things have now
they play
a role.
Yeah.
So if there are no major issues, definitely we should try an IUI, try for simple treatments before we go for an IVF. But if the female age is higher, if age is higher means like 35, 36 plus, if we do the semen factor is bad, if she has associated issues like endometriosis and other problems, multiple other problems. If you have multiple problems, then probably at that point of time,
you don't suggest
we don't say that don't waste time with IUI. Smaller treatment, because ultimately we might have to
go for IVF.
Go for an IVF. Because there is a very good analogy that we always tell our patients, like see 2 plus 2 is equal to 4. Okay. Similarly, 3 plus 1 is also 4. So what I'm trying to say here is that not necessarily both have to be perfect.
Yes.
Sometimes you see a lot of PCOD patients who get pregnant normally. Because the sexual life is so good there, because they are having a very regular sexual life. So whenever they ovulate, the sperm is there. Similarly, probably the sperm factor is very good, the sperm is very good. Sometimes you end up seeing patients with very poor sperm, but wife is easily pregnant because the wife is so fertile, it just needs some sperms to come in. So sometimes that partner makes up for the. So there's a funny thing is that, what do you say? A person can be fertile to one female and infertile to other.
Yes.
So not necessary that it is both are having major issues. Sometimes one can have a very major issue that can cause lint, or both can have small issues, just that it's not getting matching each other.
Sure.
So if you have a problem, does not necessarily mean that you will not get. Another very important thing, if you have a problem, don't think that you will need only treatment. A lot of cases who will with the problem also will conceive. So giving time to try for a pregnancy is very important.
What is the time that you usually?
Okay, now that is a very important thing. See, if you look at it now, tentatively what we always say is that we actually normally they say that in 1 year, like I said, the chance of or the possibility of you to get pregnant in a month when they're trying regularly.
Yes.
It's just not about 1 time sex or 2 times. They have sex in that particular month. In a regular ovulating female, the chance of getting pregnant is around 20%. They try for a whole year, the chance of a normal person to get pregnant is only 80%. Still, only 80% of them will get pregnant in the first month. So generally what we say is that if you're trying regularly for like say a year and you're not getting pregnant, yes, then it is time that you start evaluating yourself. Now things will be different if the situation is different. Like I said, if female age is about 36, 37, then we probably want you to come a little earlier, like say 6 months you try and then come back and then we can evaluate you. At least we'll make sure that there's no other problem, that we don't waste time on trying knowingly. If they know that they had a surgery, any kind of abdominal surgery can lead to infertility later on.
Surgery
like any any cyst in the ovary, or they had some kind of bowel surgeries or some kind of, because any surgery inside the tummy can cause adhesions. Adhesion means things will be stuck to each other. So see, everything has to be freely mobile for the normal things to happen. And if that does not happen, then infertility becomes an issue. So in these situations probably you will have to come for treatment a little earlier, older patients, if you realize that you're not sure about the sexual life. Because see, if you look at one of the biggest reasons that today we have or increasing rise in infertility is because see today I'm not saying it in a very wrong way, but women, they basically, the age of marriage is delayed. Okay, so once they get married, say 27, say like they generally get married around 24-25 years, and then they settled in there. Then they, once they get married, they, at that point of time, husband and wife don't want to have a child. Their sexual frequency is very good, but at that point of time they don't want to have a child. So they will leave another 3-4 years. Then they are stable, they have a house, and then they decide, okay, now it is time. So see, the biggest challenge today is that people plan too much, and they decide, okay, this month I will try for pregnancy, the next month I am pregnant, and 9 months I'll
right,
go.
you're so right.
So and 1 month goes mistake, yes, or first month fails, you're shattered.
I know. Yeah, okay. I know. It hits home very much. I completely understand what you're saying.
So what happens is that they don't understand, they get into the panic mode.
Yeah.
To be very honest, they've only tried for 1 month, and 1 month trying and not getting pregnant is not a big deal.
And that stress also adds to it. Yes.
But then they are suddenly that their whole world goes upside down because things have not worked as planned.
Yes.
So that is one major issue at this point. Today, now a lot of people are not able to try properly because of these, and at that point of time, after 3 or 4 years when they're trying, then the sex will be only as per the ovulation time. Like
performance anxiety.
Then performance anxiety will come. See, this is now a lot of people are talking about people getting pregnant during these COVID lockdown times. See, because there is no stress, there's nothing else to do in the house.
I know.
They're sitting at home. There is no work pressure. There is no this thing. They're spending time with each other. See, a lot of times we are having to do treatment for a lot of these people because they're not able to try. To be very honest,
it becomes a job.
It becomes a job.
Yes.
So when they were having regular sexual life, they did not want to have a child, and when they are wanting to have a child, they are not having regular sexual life. So, and at that point of time, things get they get worked up, they get stressed. So the things become, so that's why you end up seeing a lot of times today who have a child, you'll have so many years of treatment. Today I met a doctor, I was just discussing with him. He said that he had first IVF with a triplet, was twins or something, and then after a couple of years he got pregnant on their own. That stress factor is gone. Yeah. See, that stress, that pressure of conceiving is, once it's gone, a lot of people who adopt a child get pregnant.
I've also heard so many cases out in IVF. They have naturally,
so that is one information that people should know, that IVF does not mean that that is the only resort for them to get pregnant. Yeah. Probably we are doing multiple treatments, but that does not mean that they waste time and they lose the time for IVF. They should go in a step-by-step manner, reach and do an IVF. Like if things are not working out otherwise, before they get very old, before things get worse, do an IVF, get pregnant. If not, but a lot of people say, oh no, I stopped treatment, and then 37 years, when they lose hope, no? A lot of people, they lose hope. A lot of people are there who lose, especially this unexplained infertility, where we don't really know a reason for. See, then once they lose hope and they forget about having a child, suddenly they become pregnant. So many people we know. A lot of people who have an IVF failure, after a couple of months they become pregnant, or they lose every hope and they leave everything and go.
Does it have anything to do with the fact that medicine has kind of like, there's this rumor I heard, okay? It was like, oh, they have cleaned your system out. Now that you've done an IVF, they've like completely, you're cleaned out. So there's a possibility of you getting pregnant again. Someone actually, educated, told me this.
No.
So I just want to know if that is something, there's a truth to it.
I wouldn't say it is completely true, but in a part way it is true. But especially what happens is, see, all that preparations, medications and all during the IVF, we are kind of suppressing your ovary, controlling and taking control of your hormones and things like that. Those things generally, so whenever an IVF fails, and when we say that we need to repeat IVF, we always give them 2-3 months. One, basically for the reason that we want the ovary to get enough rest before we start the next cycle. Second is, we end up seeing a lot of people getting pregnant during this time. Because naturally, because one, that the ovulation gets a little better, you end up having that one egg that is good, and see, it is, see, you end up seeing the worst of cases getting pregnant naturally. We end up seeing the most simplest case of IVF not getting pregnant at all after multiple attempts.
Yes.
So it is a very difficult field in the sense that things are not in our control.
It's unpredictable.
It's unpredictable. So a patient, unless they don't have a sperm or they don't have an egg, I can never tell them that you will never get pregnant. But your possibility of getting pregnant is lesser. So let's go for a treatment. That's all we can say.
Okay.
If you waste time, you will even reduce the possibility of what is happening now also.
Now, I just wanted to ask you, you told me that you were mentioning a person who is young, who has got absolutely no problem, but was not able to conceive naturally, you would suggest an IUI, isn't it? But there's been many cases, I know friends, who even then an IUI has failed them. So how many attempts of an IUI do they have to go through before you decide, okay, the next step is IVF?
When doing an IUI also, I think the best result that we should expect is around 15 to 20%. Now, they say that technically if you are supposed to succeed in an IUI, they say 80% of them will succeed within 3 cycles. Around 90-95% of them will succeed within the 4th cycle. So it's not that you will not conceive after that, then just that the possibility of you to conceive after the 4th IUI is much lesser. So don't keep doing IUIs consistently. There are a lot of these people who keep continuing doing 10 IUIs, 12 IUIs, which is the wrong thing, because what basically happens is the more IUI you do, it's just not about, okay, yes, there was an era wherein we did not have an IVF, where we were very new to it, and like I said, when I had actually joined practice with my father, at that point of time, I had come from medical college, where we used to see people who are not affordable to do an IVF for something. We do 5 IUIs, 10 IUIs. I have seen that happen, but I was surprised that when I came here, I could see my father telling these patients like, no, you go directly for an IVF. But then it took me some time to understand why he's saying that.
Yeah.
Because there are certain situations where there's no point wasting time in IUI, and like I said, the age issues, and when the 7 factors are very poor and all, there's no role for an IUI. But if things are okay, then definitely there is a role. But then does not mean that you keep doing it invariably number of times. You can I think 3 to 4 IUIs is a reasonably good number of IUIs, and if that does not work, it is time that you go for an IVF.
Okay, 3 to 4 times you would say is the maximum. Great.